You're going to learn about a breakthrough treatment for the stubborn condition. In fact, Dr. Anderson is the first in Colorado to offer this laser treatment to help cure toenail fungus. And Dr. James Anderson joins me this morning along with his patient, Jim Leweidel, and his assistant, Katie. Hi, how are you?
Good morning.
Well, this is great news.
Oh, it's terrific.
Yeah, in the past, it's been kind of a struggle treating toenail fungus, true?
Yeah, it's a tongue twister too.
Yeah, toenail fungus.
Yeah, it's very, very hard to treat. Very persistent, very difficult. Topicals have been used in the past, Denise, and they were only maybe 10% effective. And then along came Lamisil. A lot of people have heard about Lamisil. It's an oral medication you can take. It's fairly effective, maybe 50 to 60% effective, but you have the consequence of liver toxicity.
Possible side effects.
So a lot of doctors and patients kind of shy away from Lamisil. So this is great.
Exciting news with the laser. Tell me how this works.
Yeah, the whole idea, it's just a very simple principle that works on a thermal principle or heat. It's generating a lot of heat in a small area of the nail, and it's a pulse type of laser. So it's on and off, on and off. It generates a lot of heat. It's almost like touching a stove really quickly. If you do it really quickly, it's not going to burn. And basically, it's the same concept. So it's basically just vaporizing the fungus as you do the treatment. So it's instantly killing it.
Okay, and as we mentioned before, it's not only embarrassing, but it's painful too. You can't walk through life like that. We have some pictures before and after when they were treated with the laser. Kind of walk me through these three pictures. Yeah,
hopefully it's obvious there on the left. That's a pretty dark, discolored nail, a little bit thicker, and sometimes they're a little bit irregular. They're kind of rough, not as smooth. And on the right, you can see afterwards. Okay,
big difference.
And this next one's not as severe, but on the to your left, obviously that yellow discoloration, that's fungus, and this is a more minor case. Okay. And then in the third one, and as we go through these, our viewers can kind of know it, or you probably can't know it, I guess, but the improvement tends to happen back by the base of the nail. And this isn't an instant change that you'll see. It takes a while. It's usually 9 to 12 months before you see the full effectiveness of this.
How many treatments?
Usually just one.
Just one treatment?
Yeah, occasionally you have to do a second one to get it to the improvement that the patient might want.
How long have you been offering this treatment?
We've been doing it it'll be 2 years come February.
Very exciting. Where's it offered?
We offer it in our office in Fort Collins. Then we're in Lafayette, Centennial, Inglewood, Littleton, and Colorado Springs. And we recently opened in Albuquerque for any viewers in Albuquerque. So
excellent. And we'll give you the website, too, how you can contact them through the web here in just a few minutes. But I understand it takes a while for the toe to kind of grow out for its a full effectiveness. But explain to me how the laser works. Why is it so effective?
Well, it's just so effective because of the kill rate. It's been shown in the lab to kill the fungus very effectively, and the success rate is much higher than any other treatment plans that are out there right now. It really is. And this is FDA approved. Yes, I was going to say that's the real exciting thing. My history of this goes back, almost 2 years ago is when I got trained on this, because I know the main doctor in California that did the first study, and that first study was stating that it was 88% effective at that time. So we've been doing it for 2 years. It's safe to use, but the FDA testing and approval just came through about a week ago. Oh, so that's really exciting to have that in place. And it's the first laser in the country to be FDA approved for treating fungus. We're going to show an example of how it works here in just a few seconds. Jim, the patient, tell me how it kind of affected your life here, the toenail fungus.
Well, of course, there's the embarrassment factor. You don't want to take your socks off or shoes in front of anyone. Every once in a while, your wife looking down and going, ew. And of course, the physical problems are the toenails are tender, so they can hurt. They're more vulnerable to cracking that I've noticed. And just from my experience, I think it's contributed too. Other problems with my foot, them drying out and cracking themselves, which can make walking painful or doing sports or things like that.
Did she make you wear socks to bed?
She wears the socks to bed just because she likes to wear socks.
Okay, I would imagine. In the past, what kind of treatments did you try before?
Tried quite a few things, like the doctor talked about, topicals, things like Vicks Vapor Rub, which have no effect whatsoever. Tried tea tree oil. Of course, the problem's there. You have to really keep up with it. You have to file the nails all the time, literally with a wood file. But if you miss it for a couple of days, you go right back to square one, and it's taken a toehold, so to speak, all over again. So it's just over and over, and it's no definite cure.
Well, thank goodness you finally found one. And Katie, I want you to show a demonstration. I would imagine these glasses are for me to wear for the laser. And explain to me a bit what she's doing, Doctor, as she helps out Jim.
She's, and this again, this is called the pinpoint laser. Pinpoint. And as we're doing this, she's just simply putting this up against the nail, and she'll do this in sort of a grid manner, so that she's going up and down the nail, and then she'll usually do it one direction and then do it the other direction at 90 degrees to the first treatment.
What does it feel like, Jim? Is it
There's
painful?
no feeling whatsoever.
Really?
Can't feel anything.
Yeah. Occasionally people will feel a little warmth, Denise, and if they do, Katie will just move it to another part of the nail.
Okay.
And but it's real important to understand this isn't going to discolor the nail. I've had patients think, well, my nails are going to turn black, or I'm going to lose a nail, or I might have to be numbed up to do the treatment. But
that's better than toe fungus.
Yeah, I know.
I mean, really, they're worried that it's going to, you have to be numbed up?
Yes. So it's this is it. This is as bad as it gets, really.
And this is safe, a safe procedure, FDA
safe.
approved.
There's no evidence of any, again, it's just using heat, so there's no evidence that it can create any problems at all. So.
And you have a deal today for our viewers to make this affordable.
Yes, I mean, we're going to offer a free initial visit to any of these clinics that we've mentioned today for anybody that calls in. And
very nice.
The word that I wanted to mention that really describes this, it's kind of humorous, but so many men come in. I'm surprised. I thought it'd be women, but oftentimes, just like Jim, the wife sends them in, or the wife comes with them and forces them to take their shoes off, because they're it's very embarrassing, and people often use the word icky. It's just an icky problem.
Katie, yeah, perfect. I was going to ask you if you wouldn't mind moving your hand. Now we can see with the camera, and I'd like the doctor to kind of explain what we're seeing here.
Yeah,
can we get an overview shot? Can you, would you mind, Katie, just to stop real quick? And I want you to kind of bend your toe so they can see what you've done. There you go.
Is that better?
Yes, and so she's just touching it, and it's just a little bit of heat, right?
So she touches it, and then uses this pedal, and it's basically, when she applies it, it's sending the light wave into the nail. She's going maybe about 1 or 2 millimeters, and just going back and forth on the nail. And then we have our patients come back typically at 4 months.
Okay. But just one treatment?
Yeah, usually at 4 months you don't see a lot of change. Sometimes you do, but it's more likely to see change at 9 to 12 months. And if a second treatment is needed, it's going to be more at 9 to 12 months. 4 months is a little too early to judge.
You know, a lot of people would think, ew, gross, the toenail fungus, we're going to see that. But every person in this studio is reaching their neck over to watch the camera and to see what's happening. Because I think this is really amazing technology. One treatment, a great deal for you. Thank you very much.